We'd like to begin by welcoming you to the informational session on the lumbar spinal fusion. We would like to thank you for choosing the South Carolina Spine Center to provide your care and look forward to working with you and helping you in any way that we can. Our goals for today will include what you'll do at home prior to your surgery, give you some day of surgery instructions, talk about what to expect during your hospital stay, reduce any pre-surgical anxiety you may be having, talk about physical and occupational therapy's role in your care, and how to care for yourself once you return home. I want to begin by discussing some of the terminology that you may have heard when you scheduled your surgery. It's common in any kind of spinal fusion to have a laminectomy, which is removal of the bone that's causing pressure on a nerve. The discectomy is removal of the disc that is in many cases herniated. Fusion is permanently connecting two or more vertebrae to eliminate motion in the spine. The instrumentation that we use is titanium pedicle screws and rods. Bone grafts may also be used to assist with healing. The bone graft is the use of bone and tissue to fill a space. This may be harvested during surgery, or in some cases cadaver bone may be used. The image on your screen shows a disc herniation. On the left side of the screen you'll see that the normal disc is intact, and you see that membrane is totally intact all the way around. If you look at the image on the right, the herniated disc, the membrane is kind of ruptured and the contents of that disc are spilling out and they're compressing the nerve root. When the nerve root is compressed, that is what causes the pain that's either in your arms, legs, or your back. The goals of surgery are to relieve that pain. The next image that you'll see is the laminectomy, which is very common in this type of surgery. That's when we remove a piece of the bone to take the pressure off the nerve. You'll notice that the lamina is the horn-shaped piece of bone that protrudes out. When the laminectomy is performed, that area of bone is removed, which decreases or eliminates the pressure on the nerve that is causing pain. If you look down at the bottom image, that just shows you a different view of the spine and the laminectomy. This is what a lumbar fusion looks like. When we fuse the spine, we secure everything with pedicle screws and rods that are made of titanium. They have been safety and quality checked many times. You should not have any problems with that hardware migrating out or moving. It would take a pretty significant amount of trauma in most cases to do so. We're going to begin by talking a little bit about what you'll do pre-operatively to prepare for your surgery. It's very important as you prepare for surgery that you make sure your home has been put in order. We want to make sure that you've shopped for groceries, prepared or stored meals. For people who have a lot of family around, you may have a lot of help. That might not be such a big deal for you. But for other people who may be spending a lot of time alone, food preparation is a big deal. So you want to make sure that you have things that you can easily warm or prepare for yourself. You're not going to feel like standing and cooking meals. You want to move regularly used items to counter or table height prior to your surgery. So after you have a lumbar fusion, you're not going to be able to bend and twist and get things out of lower cabinets that might be heavy or awkward. So we just ask that you prepare by putting those items in a place that you can easily access them without straining your back. You'll want to remove any throw rugs or electrical cords that could cause you to trip. You need to make sure that your hallways and rooms are clutter-free and well lit. We do recommend non-skid mats in your shower or bathtub. It will also be important to have a comfortable chair with high backrest and good armrest for your recovery period once you return home. And you do want that chair to be stable or fixed. You don't want anything that could roll or move and increase your risk of falling. It's very important that you keep clean linen on your bed. We do not advise sleeping with your pets during the recovery period. We also suggest that you have someone assist you with caring for your pets. Large dogs can be a danger as far as knocking you down. Smaller dogs tend to get underfoot and can cause you to trip or fall. We also do not recommend cleaning cat litter boxes for the first few months. We would not want you to introduce any kind of foreign bacteria to your surgical incision site because this could greatly increase your risk of having a post-operative infection. Infection prevention will begin at home prior to surgery. The number one cause of surgical site infections in any type of surgery stems from the bacteria that resides on the skin normally. During pre-testing, the surgery scheduler would have given you 3 packets of CHG wipes. You'll start using those 2 days before surgery, and the last pack will be used the morning of your surgery. You'll take a bath as you normally would. When you get out of the shower, you'll dry off, wet your CHG wipes, and then you will apply them to your body. If you'll look on page 16 in your surgical guidebook, there's a diagram that will assist you in proper application of the wipes. You will not use wipes on your face or your growing area, and the wipes are numbered. There are 6 in a pack. It tells you on the diagram which one to use on which body surface. I do advise that you pay particularly close attention to the lower part of your back. Have someone help you with that, since that will be where your incision is located. The great thing about these wipes is that they continue to kill germs for several hours after application. So this is very important. Do not wash it off after you've applied them. If for some reason a rash develops, you do need to wash it off with soap and water and discontinue use of the wipes. It is not very common that you would have a reaction, but some people will get a little skin irritation from that. Be sure that you do not flush your wipes. They will cause major plumbing problems for you, so you need to discard those into a wastebasket. The second thing that we'll do to prevent any post-operative infection will be to provide you through your pharmacy with an ointment called mupirocin. It comes in a little tube. It will be called into your pharmacy once you're scheduled for surgery. You'll start using the ointment 5 days before surgery and will use it twice a day. You're going to apply a pea-sized amount to a cotton swab, and you'll swab it into each side of your nose twice a day for that 5 days. The goal of the mupirocin ointment is to cut down on any bacteria that may be colonized in your nose. MRSA, or MRSA as it's known to some people, is colonized in the nose. So we want to make sure if you have MRSA or MRSA that we are killing any germs that may be colonized in your nose, just as an added layer of protection to prevent any surgical site infection. So if you have not done so already, you'll be scheduled for the Ready for Surgery Clinic, which was formerly known as pre-testing. That has moved to the Tower Point location at 105 Vinecrest Court, right up the road from the hospital. Call 725-4002 if you need to change your appointment. We do request that you arrive 5 to 10 minutes prior to your scheduled time, just to make sure that you get in and get to the right location in a timely manner. On the day of your pre-testing appointment, we ask that you bring any insurance cards you have, including private insurance, Medicare, Medicaid cards, and a valid photo ID, preferably a state-issued ID. If you do not have that, we request that you bring a Social Security card and another form of ID. Bring all of your current medications in the original containers, no pill boxes, and also include anything that you take over the counter, any vitamin or herbal remedies as well. You may be instructed to stop or change some of your medications before surgery, such as blood thinners, insulin, over-the-counter medicines. They will give you the instructions for that when you have that appointment. You'll also be instructed what medications to take the morning of surgery. A nurse will review your full health history with you. Your surgeon or anesthesiologist will order lab work and other tests to ensure that you're healthy enough for surgery. Commonly ordered tests would include blood and urine test, a chest x-ray, or an EKG. Inform the surgeon of any infection, dental issues, fever, rash, etc. prior to surgery. We want to make sure that you're healthy enough, since this is an elective surgery. Not doing so can lead to your surgery being canceled, because we want to prevent any unnecessary risk or complications that could cause you problems down the road. The arrival time to the hospital. You will call the day before surgery, 725-4001 or 725-4002 between 12 noon and 5 p.m. the day before surgery. They will give you your arrival time for the following day. If for some reason your surgery is scheduled on a Monday, you'll call Friday between 12 and 5 to the same numbers, and they'll tell you what time to arrive at the hospital on Monday for your surgery. On the day of surgery, when you get up, you will use your last pack of the CHG wipes prior to coming to the hospital. You want to make sure that you've prepared a bag that includes loose-fitting clothes. We recommend shorts, t-shirts, lounge pants, or things that are not going to be binding when you move. You'll want something with a flexible waistband just for your comfort so that it won't irritate your incision. We do recommend walking shoes, no flip-flops or sandals. You'll need these with therapy. And it's very important that you have your back brace with you when you come for surgery. You'll need it the day of surgery, so be sure that your family does not take that back home. We also suggest that you bring your spine surgery guidebook with you. We will often refer you to the information in the book, and it also has a list of your follow-up appointment times and dates. On the day of surgery, you'll report to the Childbirth and Surgery Center entrance of the hospital on Spring Street. That is indicated with the yellow, red, and blue circle over near the B entrance on the main campus. The glass on that portion of the building is red, yellow, and blue panes, so it's easily recognizable. When you come through that entrance, a security guard will direct you on where to go from there. You can bring one family member with you the morning of surgery. Once your surgery is completed, the surgeon will come out and talk to you about how the procedure went and what to expect. Given the current climate with COVID, the visitation policy is subject to change, so please ask the surgery scheduler to clarify the current visitation policy. Due to COVID, there may be some unanticipated changes in that schedule from time to time. For the procedure, you will have general anesthesia. The anesthesiologist will review the health and medication history and discuss any nausea or pain management concerns. If you've had surgery before, it's very important that you discuss your prior anesthetic experience with the anesthesiologist so that we can customize your anesthetic so that you have the least likelihood of any kind of complications or problems from anesthesia. In the operating room, there's a CT scanner in the OR that allows the surgeon to precisely place the screws within a millimeter of accuracy using real-time imaging. This is very important to ensure that you have the best outcome and that the hardware is fitted in the proper place where there's no pressure on the spinal cord or the nerves. Post-operatively, on the completion of your surgery, you'll go to PACU, which is the post-anesthesia care unit. You'll have a 1 to 2 hour stay depending on how you feel. They'll stabilize your vital signs. They'll do a neuromuscular assessment, which means that they'll check your hand grips and your foot presses just to make sure that there are no problems. And they will also use comfort measures to make sure that your pain is well controlled, treat any nausea you may have, or any other thing that comes up related to anesthesia. Throughout your stay in the hospital, you'll be asked to rate your pain on a 0 to 10 scale. Your medication orders are based on how you rate that pain on the scale. From 0 to 3 will give you the mildest medication. From 4 to 7 gives you something that's a little stronger in the moderate range. And from 8 to 10 is considered severe pain, and we will give you the strongest medication to ensure that you are able to remain comfortable and do what you need to do. We do have to take into consideration your oxygen levels, your alertness, your blood pressure, and other factors to determine if pain medications can be safely given. Some of the different types of pain that people who've had spinal surgery will experience would be incisional pain, which is exactly what that sounds like. That's pain at the incision site. It's a soreness, it's a pressure. It responds very well to the pain medications. The muscle spasms are the tight grabbing sensation in the lower back caused from going through the muscle during the surgery. We treat that with muscle relaxers 3 times a day, and typically it responds very well to that. The third type of pain, which is often what gets you into our office as a surgical candidate to start with, is the shooting, stabbing, or burning sensation in the arms or the legs. Please understand that the nerve pain may persist after surgery or may be slightly worse due to manipulation of the nerves during surgery. We do have some different treatment options for that. We often use gabapentin, Lyrica, or even steroids at the surgeon's discretion to control that pain. Some patients will wake up and be pain-free. Others, it may take a little bit longer to heal. Do not be discouraged if when you wake up from surgery or in the first few days or weeks post-operatively you still have some leg pain that tends to bother you. That should get better with time as the inflammation heals. Remember, your pain medication will not make the pain go away completely. We aim to manage the discomfort so that you can eat, sleep, and participate in therapy. The pain medications are not scheduled, they do have to be requested. If for some reason the medication is not effective, please let your nurse know. We also encourage you to ask questions and be sure that you understand the pain management efforts that are in place. You'll also have a cold therapy unit. It's called a polar ice. If you notice in the image there is a cooler that has a long hose that goes to a pad behind your back or your surgical site. It circulates cold ice water to the incision site to decrease the pain and the swelling at the operative site, and most people really like that. It helps them to be more comfortable. There are two types of dressings that you'll be exposed to while you're healing from your surgery. On the left is the Aquasil dressing. We use that in the hospital only. We will replace your Aquasil at the time of discharge. When you go home, this dressing is waterproof. You can shower with it on. If for some reason that dressing starts to roll up, it's coming off, it's soiled and needs to be changed, we'll also provide you with the dressing on the right, which is called an island dressing, that can be replaced as needed at home if it becomes wet or soiled. But we do like for you to leave the Aquasil in place for the first 7 days as long as it's intact. You will also have a JP drain. If you notice in the image, there's a bulb that will be attached to a little bag. It will drain away the old blood that collects under the skin. The drain can stay in for up to 3 days. It will be removed prior to discharge. The blood that it drains from that surgical site is not useful to you, so we simply pull it out from that incision site and discard it for comfort. The day of surgery, you'll need your back brace. We will put that on anytime you're out of bed, except for when you're showering. The therapist and the nurses will work with you on proper application of the brace. The spinal precautions will be reviewed with you by the therapist and the nurses. We call it the BLTs. No bending, lifting, or twisting, and they'll work with you on how to avoid those things in your everyday activities. We do suggest that you not lift anything heavier than a gallon of milk. Physical therapy will begin the day of surgery as long as you're in your room by 4 o'clock. They'll work with you on getting in and out of bed, in and out of a chair, walking and climbing stairs. The occupational therapist will help you more with your activities of daily living, bathing, dressing, and your hygiene needs. The occupational therapist will provide you with a packet of assistive devices, a reacher, a sock aid, a long-handled shoehorn, and a bath sponge to help you to care for yourself without compromising yourself and bending, lifting, or twisting. Some of the equipment that you may need at home would include a rolling walker, a bedside commode, or a shower chair. Insurance will normally cover a walker every 5 years. Insurance will likely not cover a bedside commode or a shower chair. We are more than happy to prescribe those if you feel like you need them, but just be advised that most insurance will not cover them and you will have some out-of-pocket expense for those items. So we're going to talk a little bit about preventing post-operative complications. One of the biggest risks for any type of surgeries is blood clots. So while you're in the hospital, you'll have these sleeves on your legs. These are called antithrombotic pumps. They pump up every few seconds. They'll give your legs a little gentle squeeze to make sure that the blood is not pooling in your legs to put you at risk for blood clots. It is very important that you get up walking frequently and walking early after your surgery to prevent any complications. We do ask that when you're sitting in the chair that you pump your feet and ankles a few times every hour. During commercials is a good time if you're watching television. That also helps return the blood that's pooling in your legs to your heart so that you're not set up for blood clots. Another risk of having any type of surgery is pneumonia. So on the day of surgery, a respiratory therapist will bring you an incentive spirometer. This is a device that helps us to exercise your lungs so that you're coughing and deep breathing properly and you don't end up with a pneumonia post-operatively. Anytime you have surgery, there's also a risk of infection. As you know, you'll be using your CHG wipes that you were given at pre-testing. You will also have the mupirocin ointment that you swab into your nose, and you'll have IV antibiotics when you're in the OR. Anytime that you're taking a lot of pain medications, you're at high risk for constipation or ileus, which happens whenever your digestive process slows down. It's very important that you're up walking frequently and early. We want to make sure that you're properly hydrated, and we will also use stool softeners to prevent any constipation or ileus from occurring post-operatively. It is very important that you not smoke in the post-operative period. Smoking drastically increases the risk of post-operative complications, including poor bone fusion, which means that the fusion just doesn't heal. It's called a non-union. Infection, the risk of infection is much higher when you smoke. And problems with adjacent levels at the fusion site, meaning the levels above or below the hardware, are at risk for failing due to smoking. So it's very important that you not smoke or use any kind of nicotine in the post-operative period. If you need patches, please let us know. We will be glad to prescribe those for you in order to make you have an opportunity to be more successful. The transition to home. The discharge plan is discussed daily beginning the day of surgery by the surgeon, the physical therapist, the occupational therapist, nurses, case manager, and the spine care coordinator. The discharge needs are determined on the PT and OT evaluation. Some of the discharge planning options may include home with your family or home with home health PT and/or OT, depending on what's recommended by the therapist. At discharge, you'll be given a list of medications to take. The list may include new medications. It may include changes to some of the medications that you took prior to surgery, including stopping or changing the doses. We ask that you take any pain medication you receive exactly as prescribed. In some cases, if your pain medication exceeds a certain amount, Narcan will be offered. It is not required that you fill it, but it is mandated by our state law that we offer you the prescription for it. You will avoid all NSAIDs. NSAIDs are your anti-inflammatory drugs, including Motrin, Advil, Aleve, BC powders, Goody powders, naproxen, a lot of arthritis medication, and aspirin. You will not be able to take those medications until your surgeon clears you to do so somewhere between the 6-month and 1-year mark after surgery. We do not want to do anything that could slow down the healing process after a fusion. If you need medication refills, we ask that you call the office. Calls received after 3 o'clock will not be called into the following day. Please call in any refill request at least 24 to 48 hours before you run out of medication to prevent any lapse in your medication. Caring for yourself at home. It's very important that you change your position hourly. You need to be up walking frequently inside your home. Wear your brace as instructed, which is anytime you are out of bed. No bending, lifting, or twisting. We want you walking daily and steadily increasing your distance. We do ask that you limit your stair use the first week at home. I know in many cases it may be unavoidable to some point, but we recommend that you not do it any more than what you absolutely have to that first week. In the mail, you will receive a bone growth stimulator. This is what that device will look like. It will be mailed to your home sometime after surgery. You will not use this until around the 1-month mark, so don't be alarmed if you don't have it already. You'll be contacted by the DJO Global Sales Representative who will schedule a demonstration. You'll use the device 30 minutes a day for the first 4 months after your surgery, beginning at the 1-month mark. We want to ensure that you're successful by encouraging you to have coaches, a family, or a friend that can help you at home. Prior to discharge, we'll review with that person how to change your dressing, signs and symptoms of a wound infection, the do's and don'ts of pain medication, signs and symptoms of a blood clot or pulmonary embolism, spinal precautions, meaning no bending, lifting, or twisting, and then the application of the brace. We'll discuss how to assist the patient in and out of bed. up and down stairs, in and out of the chair, and then we'll also discuss the exercise program that you'll follow. We want to make sure that you guys understand exactly what care is needed at home and that you're set up for success. At any point during the process, if you have any questions, we ask that you contact the Spine Care Coordinator at 864-725-5872. If you get a voicemail, we ask that you leave a detailed message including your name, date of birth, and the best contact number so that we can return your call and answer any questions that you may have. Once again, we'd like to thank you for choosing the South Carolina Spine Center for your upcoming surgery. And we look forward to providing you with excellent care in the future and exceeding all of your expectations.